Hello and greetings to everyone joining us from different parts of the world. Myself, Dr. Deepak Parchwani, serving as a coordinator of APFCB webcast and e-learning program. So, on the behalf of APFCB and Communication and Publication Committee, I extend a warm welcome to all our participants. Thank you for joining us today for your keen interest in advancing laboratory medicine. This program was initiated to foster the knowledge sharing and professional development across our global community. Through this platform, we aim to bring expert insights, latest advancement, and meaningful discussion that contribute to the growth of laboratory medicine. And in this initiative, Quiddle Ortho serve as our knowledge partner. And to guide us through today's session, it is my pleasure to introduce our esteemed moderator, Dr. Sarah Jain. She is a past president of Philippine Council for Quality Assurance in Clinical Laboratories, but she continues to serve the organization with a focus on education and training. A pathologist with expertise in anatomic and clinical pathology, she holds certification in Lean Sigma ISO 15189, leadership and management, breast pathology, and molecular pathology. She is a distinguished expert in the field and has been actively contributing to laboratory medicine through her research, leadership, and educational initiatives. So, with that, now I invite Dr. Sarah to take over and lead us through today's session. Dr. Sarah, please.
That kind introduction, Dr. Deepak. Good day, everyone. Mabuhay, and a very warm welcome to all participants across Asia, the Philippines, and even beyond. It is our great honor and enthusiasm that we have this webinar this afternoon, organized by the APFCB, and of course, for quality assurance in clinical. Very special because it's our in offering free educational colleagues across the Philippines, but this is happening with APFCB to share our advocacy for quality laboratory medicine with a broader audience. So thank you, Dr. Pradeep and Dr. Deepak, for all your help and support. Find the audience that you can Q&A box. In more participants from the Philippines for the attendance for your CPD is already on your screen. You can also download your certificate of attendance by clicking on your screen. And also there's an EQA survey that we hope that you'll also find. All right, switch to introduce our two experts in the field. First, let me introduce her who will be talking about the basics of EQAP and interpretation of results. Dr. Paulo Enrico Belen is a graduate of the University of Santo Tomas with a Doctor of Medicine degree at St. Luke's Medical Center. He now serves as Assistant Chair, the QC and Global, also a past president of the Philippine Council for Quality Assurance and Clinical Laboratories, and he has long been active in education and training. Dr. Belen is also a certified ISO 15189 auditor and has completed multiple trainings in laboratory quality systems and management. So let's Dr. Paulo Enrico Belen.
Dr. Sarah, for the introduction, and in behalf, thank you APFCB for this opportunity. So for this afternoon, my task is to discuss the basics of EQA, P, and its interpretation. So this is the outline of my lecture for this afternoon. I will give a brief introduction of what EQA or PT is. We will discuss the basic process on how to go about the EQA or the PT process. We will also discuss essential points and key parameters of an EQA program that each and every one of us should know before we start interpreting. And then we have one case for interpretation. So, what is an EQA program or what is an EQA scheme, otherwise known as proficiency testing? An EQA program or PT is a program in which samples are periodically sent to participating laboratories for analysis. Each laboratory results are compared with those of other laboratory results, and then the provider will actually generate a summary where we can get information for improvement. A PT program or an EQA scheme also is a mandatory requirement for some accreditation programs like the ISO 15189. So, what are the objectives of an EQA scheme or an EQA program? In general, it is to detect analytical errors and make necessary corrective actions for quality improvement. So, for specific objectives, of course, we want to monitor and document the analytical quality of a laboratory. We need to identify poor performing assays or tests. It will help us detect equipment failure or reagent problems. It will aid us in identifying potential corrective actions and evaluate their effectiveness. It also, on a bigger scheme of things, used to improve interlaboratory agreement. In some certifications and accreditations, some laboratories use it to assist in the verification of staff training and its effectiveness. It's also used to demonstrate commitment for continuous improvement and quality assurance to customers. So, what is the difference between internal quality control or IQC and EQA? IQC or internal quality control are procedures that we run every day and we generate results per run or per batch. And then after looking at the results, we now see if the run or the machine use is acceptable and fit for use. In other words, if we generalize it on technical terms, technically using IQC, we see the precision of the machine. For EQA, it is a process that allows a laboratory to ensure that the results of its assay are consistent with other laboratories. So the difference is there is some sort of comparison here. As the EQA assigns both targets and values, allowable performance therefore tests both the accuracy and precision of the laboratory depending on the information that the PT program actually gives out. So for EQA, although this is periodic, this is not done daily, we see the accuracy of the test runs that we actually have, and if the provider actually give other information, we can get the precision. So that's the main difference, precision and accuracy. So this is according to CLSI QMS 24. This is the general process on how the PT process should go about. So the PT process or proficiency testing process is defined as the sequence of events that enables the laboratory to monitor, assess PT performance. The process begins with the identification of the need to do PT tests and to be performed in the laboratory for quality. So part of the process of identification and determining the PT program is choosing the provider of the PT program, choosing to plunge into the PT program, or going into other mechanisms to test PT like alternative PT programs that the laboratory may actually go into. If you follow the steps of the PT program, these are the general steps. Securing and examining PT samples, to be followed by submitting the results to the provider for evaluation. Review PT performance reports from the provider. And then most take any necessary preparatory examinations. Always remember that the value of participating in an EQA depends on the proper evaluation and interpretation of the EQA results or data. So these are the things that we should know about regarding a PT program before we plunge in. We should know and have a knowledge of what EQA material the program is using. We should know the process used to get the target value and assignment of target values in the program for specific analytes. The number of replicate measurements of the EQA sample should be determined, how many times you should run it, and then before submitting it. We should know the acceptance limits. Of course, the range for acceptable values should be set so we would know if we would fall in that range between lot variations in reagents used in the measurement procedures. So more specifically, the EQA material. The most important concept in acquiring an EQA material in a PT program is commutability. A commutable EQA sample behaves as a native patient sample and has the same numeric relationship between measurement procedures as is observed for a panel of patient samples. A non-commutable EQA sample includes matrix-related bias that occurs only in the EQA sample but not in authentic clinical patient samples but may affect EQA result. This is very important because if you get a non-commutable EQA sample, this might bring in biases that would give us difficulty in analyzing the data, the summary report that the provider gives us. Thus, it will actually give difficulties in interpretation and, of course, in our movements or actions for improvement. So EQA material should be tested for commutability, especially if there are different methods participating in the program. This responsibility is actually on the provider's side. They should test the materials they're using for commutability. But as users, as the laboratory end users, we should know if the provider that we are getting are providing is providing EQA materials that is commutable. The EQA sample also should be stable during the survey period. It should be available in sufficient volumes. It should have clinical relevant concentrations. So the concentrations or the values that the EQA program should be giving out should be significant at the clinical decision points or clinical decision levels. So another essential parameter that we should know in an EQA program is how they assign target values. How the provider actually assigns a target it is best if the target value assigned could be made using a reference measurement procedure or a high specificity attributable to a reference. So I'm pretty sure you some of our audience have participated in different programs. So that's the assigned value. After removing So you would expect that there's a lot of variability there that may actually affect the target value. So in choosing a provider, we should find out on how they actually take out those outliers and how they do it. So the target value assigned per analyte for analysis would actually be useful and to the nearest possible or best target possibly set. In a commutable EQA sample, a common reference assigned value may be used. The measurement, so also still for assignment of target values, the measurement procedure with most participants will have greatest influence on overall mean or median. The peer group mean or median may be used to give the same weight to each peer group for programs for each peer group. So for programs like Biorad, they should at least have 9 participants to form a peer group. Okay, so still for assignment of target values, a common reference assigned value should not be used. Again, a common reference assigned value should not be used if the EQA sample is not commutable. So the knowledge of commutability of sample is very important. If the EQA sample is not commutable, the participants are categorized and evaluated by peer groups that represent similar technology, similar reagents, similar machines, so that these have the same expected matrix related bias. So in the interpretation, grouping them together would actually eliminate, quote unquote, the bias that the differences in matrix could have. So just a picture to give examples on how the target value can be computed. It may be based on all participants. It may be derived from participants in the method and in the peer. So third important is the assignment of acceptance limits. When we know the target, we should know the limits. Acceptance limits are important to assess if an EQA result is acceptable or not. The acceptance limit in general can be considered regulatory, statistical, or clinical. Both regulatory and clinical limits are fixed, and the uncertainty of the assigned value will be a fraction of the acceptance interval. So, specifically for regulatory acceptance limits, regulatory limits have the intention to identify laboratories with sufficiently poor performance that they should not be able to continue to practice. These limits tend to be wide and are often based on fixed quote unquote art. A good example for this is the USA CLIA clinical laboratory improvement amendments. They actually have some target limits in their requirements. So for statistical, which is most laboratory actually use, statistical limits are based on an assumption that the measurement procedure is acceptable if it is in concordance with other using the same method. The assessment of the individual laboratory is given as z-score. Some programs call it z-score, some call it SDI or standard deviation index, which is the number of standard deviations ST from the assigned value, the EQA results, or its distance from the target value. This is mainly computed by subtracting your result from the target result and dividing it by the standard deviation computed in the group. So just an example here, this is how, this is from the QMS 24 of CLSI. This is an example of a report from that standard. So if this is, for example, the target value, usually the mean of the peer group, this is the result. So it's 3.6 minus 3.1 divided by the standard deviation, and then you get the SDI or the z-score. So depending on the z-score, it may be positive, it may be negative. If the laboratory result is greater than the target value of the peer group, it's usually on a positive. If it's lower than that, it's on a negative um, result or score. So in general, because we so people not too familiar with EQA can actually relate. It's somehow similar to the Westergaard rules 1-2s and 1-3s. In general, if it's quote unquote 1-3s or the z score or the distance between the from the target mean is three standard deviations, if it's already above that, that's unsatisfactory or unacceptable. So if it's within two standard deviation or the z score is less than two, definitely it's satisfactory. So some programs actually have a warning or questionable results. That's the results falling in between 2 and 3 SDs. So the key is to know your EQA program because some programs just use the if it's over three standard deviations, it's out. If it's within, it's in. So know your program that you are using on how they interpret. So we have two examples here. This is the one I showed a while ago. So these are the z scores or the SDI. So 2.5. It's within three standard deviations, so it's acceptable. So this is more than the second sample B is more than three standard deviation, or the z score is or the SDI is above three, so it's unacceptable. And then the last sample is within the limits, so it's acceptable. So this is the one just using the third standard deviation or z score SDI more than three as a rule for acceptance. But as you can see, and this is an example of the report of Bio-Rad, just part of the summary, there's a green check here if it's well within two z-score of 2 or SDR, two standard deviations. If it's in between, it's a yellow, maybe you should think about it. And then it's a red if it's more than three. So again, the acceptability limits or acceptable acceptance limits is dependent on the program is dependent on the protocol that you will set in your own laboratory. All right. So a disadvantage is that these limits are variable and may change with time as methods and instruments evolve. So because it's statistical. Another disadvantage is that the statistical based criteria is that the limits may vary between peer groups. A group with a more imprecise method will have larger acceptance limits, whereas the group with a more precise method will have a smaller interval for acceptance of results. So for clinical limits can be based on difference that might affect clinical decisions in a specific clinical situation. These limits are desirable but may be difficult to implement because very few clinical decisions are based solemnly on one particular test. More common are clinically established limits derived from biological variation in general. So replicate measurements. Please look at the instructions for use of the EQA program on how many times you should run the sample before submitting it. Because EQA results are meant to reflect results of patient samples, and in most of the scheme, the participant is asked to perform a single measurement of the EQA sample. The acceptance limits are established according to a total allowable error concept. Remember that total error is assessed because bias, imprecision, and analytical non-specificity can contribute to variation in a single result. So I know some laboratories do run the test twice before submitting and getting the average of the two runs. But again, look at the IFU on how the test should be performed in that EQA program because it will actually affect the results or your performance. So between lot variation in reagents used in measurement procedures may influence participant assessment in EQA. Lot variation difference has been described significantly in several publications for glucose strips. So in EQA programs for glucose strips, the between lot variation really has a big impact. But the problem again is that we can't control the number of lot numbers in the market for our participants. More importantly, the EQA organizer or the provider should, however, provide some instances with comments on lot variations in feedback reports. So in the summary, if the lot if the lot number of the participants are too valid, it would be good if the provider will actually give a comment on that, or if there's actually a lot number that actually participated, that actually was pulled out or had problems, they should mention that. So finally, just sample interpretation. So the provider for this example is Biorad, and then the analyte is glucose. So just to fast forward, I zoomed in. So for this, for the glucose, for this laboratory, the result that actually was given by the lab is 602 mg per dl. In this program, there are 475 participants for the peer group. So based on the z-score or the SDI, it gave a 0.24 deviation from the target mean. So we interpret these results as acceptable or satisfactory. So it would be very easy to interpret if the samples are always satisfactory and acceptable. But what do we do if the sample that we, or the results from the sample that we performed was unacceptable? And that would be the task of my boss, Dr. Rodelio Lim. So for my part, an introduction and basics of the EQA, thank you very much for listening.
Thank you so much, Dr. Paulo Enrico Belen. We now have basics of EQA and also interpretation. Then moving forward now to troubleshooting and practical tips, we have our next speaker, Dr. Rodelio D. Lim is a fellow in both anatomic and clinical pathology under the Philippine Society of Pathologists and has dedicated decades to advancing clinical pathology through education, leadership, and service. A graduate of the University of Santo Tomas for Medical Technology and Medicine, he also completed leadership programs at Ateneo and the Asian Institute of Management. He currently chairs the Institute of Pathology at St. Luke's Medical Center, both global and QC. Dr. Lim has served on key committees in both PSP and the Philippine Council for Quality Assurance in Clinical Laboratories, particularly in education and training. Let's now give a warm welcome to Dr. Rodelio Lim.
Okay, thank you very much, Sarah. I hope you can hear me well.
Yes, we can hear you, Dr. Nadia.
So moving on. So
Hello, everyone. There's seems to be an technical issue, so we're trying to fix it now. Thank you for your kind understanding.
Do I
Dr. Wei,
do I go back a few slides? Or no.
Yes, Doc. I think we were not able to hear the first part of your lecture, the first slide. Hello, everyone. We apologize again for the technical issues. Dr. Rodelio Lim will try to reconnect right now. So, for those who are asking about their certificates, the QR code is flashed on your screen on the bottom side on the left. Dr. Rodel, are you there?
Sarah, oh, Sarah, I can hear you now. Can you hear me?
All right. Yes, we can hear you, Doc.
Okay, do I
Thank
go
you.
back a few slides or I start with this one?
I think we weren't able to hear the first slide, Doc.
The first slide, okay. So the first slide simply tells us the kind of personalities or personnel that we have in the lab. So we can consider that some of us or many of us will have good knowledge of all the reports. Some will have good knowledge of core reports only. Others will only have average knowledge of the reports or the call reports. And of course, majority or maybe all the laboratory personnel will be required to have at least basic knowledge of EQA's reports. But still, as the new medical technologies come in and as new lab personnel will be hired, of course, we will be able to identify personnel with no knowledge at all. So moving on, when we receive our reports, it is essential that we know that the participation in an EQA program itself does not lead to an improvement in quality of analytical performance. So the act of participation is not a guarantee that you will have a good lab performance. The EQA results must also be interpreted and understood, and this understanding and interpretation will require conclusions as well as require corrective actions. So what should you do when you have poor performance? So each EQA report should be evaluated and any poor performance should be investigated. And essentially, you go through 3 simple steps. You investigate the source of the problem, you implement corrective actions, then you check the effectiveness of the corrective actions that you have implemented. So to sort of present detailed steps, no? So we start off with a question: is the result within acceptable performance limits? So if we answer to this question is yes, therefore we have to review the performance over the cycle. So typically for chemistry, we have 1 sample per month, and usually we'll have a cycle of 12 samples that covers a year. And we can review our Levy-Jennings chart soon after that and identify whether any points will be outside 1 plus minus 1 standard deviation. So if this will be identified as such, therefore no further actions should be done. But then if you have any values that will exceed plus minus 1 standard deviation or more, therefore you have to look for trends, whether the results are going up towards a positive side or going down towards a negative side of the standard deviation. Or you can have poor precision as an effect that resulted to this problem. And of course, you also have to observe whether there is a change in the performance of the kits or the instrument that you are using for the test. On the other hand, if the result is not within acceptable performance limits, therefore, we do identify any transcription error. So this is the most common error that has been the cause of results going out of the acceptable performance limits in most EQAS programs. So if there is transcription error that has occurred, you have to send the correct result along with relevant documentation to the EQAS provider. And of course, if there's none, therefore you have to verify assay details. And if the verified assay details has been identified to have some transcription error, therefore you have to advise your EQAS provider of the correct details. So you have to review the summary page and of course identify whether the majority of the results are flagged or not. Because if there are many analytes that have been flagged, therefore you have to identify other concerns or other causes of this concern in the using your EQAS reports. So if your review will show that majority of the results are flagged, therefore there may be a problem with the sample. Did you use the right sample or not? Or did you do the correct reconstitution of the sample as instructed in the program? Or there will be other issues that has affected the sample. If not, the majority of the results will be flagged. Therefore, you have to review the instrument parameters and also the calibration and also check the reagent batch, whether it has been changed as to lot number and also as whether there is a change of the batch of the reagent that has been used with some sample compared to the other samples in the batch of EQAS samples. Then you also have to review your internal quality control results from the time the EQA sample was tested. So moving on, after the review of these IQC results, therefore, you have to check whether your controls are out. And of course, if the controls are out, you have to also look for shifts or trends. So shifts will be shifting from the negative side of the standard deviation in an abrupt manner. And trends, of course, is a slow transition of the results from the negative side to the positive side or vice versa, no, of the standard deviation. Then after the investigation, you have to take your corrective action and implement these corrective actions. So to give you some examples later on. So establishing a root cause analysis is essential, no? Because this is, the process is supposed to be asking why the problem occurred, and also then continuing on to ask why that happened until we reach an answer. The goal of root cause analysis is to find out what happened, why did it happen, how can it be prevented from happening again, and how do we know we made a difference. So the root cause analysis process or procedure is a team approach. So meaning to say it has to involve the technicians, the quality manager of the laboratory, up to the laboratory director. This also involved once in a while the suppliers or the product specialists of the testing kits that you are using, and also the instrument experts to really identify the root cause of the problem. So this is a team approach. I would like to emphasize this, that this does not only involve the one who performed the test itself, but also the other personnel included in the process. So we have the technicians as they have been performing these tests, as we know, and there will be managers that oversee what they're doing, and also the laboratory director. So in the results that you get, typically you will also get symbols, no? So this is just an example that these reports show 3 red triangles. And of course, I think the other providers of these services will have different symbols that they use. But then what is essential is that you have to be able to identify these analytes and attend to these analytes first, no, prior to looking at the other analytes. So you should look at these parameters because this analyte failed a specific performance indicator. Then the analyte failed, all performance indicator will be identified with those red triangles. And of course, the indications is that the long-term poor performance will affect the performance of the laboratory, as well as also the procedures that you are handling, and also the effect on the patients and the clinicians. The lab will be reported also to the regulatory body if it's a practice in the country for this particular analyte. So poor performance for all 3 performance indicators like the standard deviation index, the percent deviation, and also the target score are indicated by a red triangle on the summary page of the report. So for this particular report, we have albumin, we also have amylase, and lipase as the 3 analytes identified to have failed the 3 performance indicators as mentioned, the standard deviation index, the percent deviation, and the target score. In some cases, we can receive reports that all the analytes have been affected, no, as to performance. So you can see that this sample showed us that almost all the analytes will be marked with the red triangle. And therefore, these are all away from the mean, and also away from the peer group results, and also away from the method results, no, depending on the test method that they have been using in the lab. And also you can see sometimes that the reports can show the words too few, and this means that there will be very small sample that has been received for a dependable or realistic statistical analysis to be done. So the too few simply mean that there is no target score available for this analyte. There are too few returns for this sample, and there are too few returns from the lab for this analyte. Or for this particular analyte, there are no results that were submitted. So in cases wherein almost all analytes have been targeted or identified to have poor performance, always consider the sample. So the issue with all the parameters flagged with red triangles is typically wrong sample tested. Also, the reconstitution of the sample could be the source of the wrong or maybe the poor performance of the analyte. it could also be the fault of the analyzer. So you have to really check with your supplier, the engineers, and also identify or review the calibration and also the running of IQC. And another thing which is more common among medical technologists and lab personnel is error in transcription of the reports. So meaning to say they have placed results not places, and therefore as the results are coefficient variation of all the results submitted for this particular test, which is testosterone, is only 19.2%. But a particular brand identified here as Biomiriu showed 34.4% CV per coefficient of variation. So this simply means that there is something wrong with the submission of that particular lab or group of labs that show that these reports that show that the use of these kits have shifted from one side of the results and also to the other side of the results. No? So meaning to say there is a big difference between one run and the succeeding runs. So it has been brought to the attention of the supplier, and therefore BMU brought out a new kit which was giving much lower results. This has been identified, and the EQA program typically would allow a separate group method. A separate method group was set up for this particular new kit, so that the users of this particular new kit will also be grouped together and come up with their own coefficient of variation not far from the other participants in the EQA program. So if the new kits become available from the manufacturers, you have to let your EQA program provider know that so that they can investigate if a new method code is to be required. So I think this is, again, another thing that you have to look into as you interpret your reports, as this can happen, as the different manufacturers of the kits that we're using in the lab can change their testing material sometime, no? So it cannot be consistent once in a while, and therefore you have to be able to identify that this can happen, and therefore we have to address this particular problem. So last but not the least, this is one of the most common queries, no, that will be usual, leading to an EQA result that is not acceptable. So incorrect registration accounts for almost series is what they have identified. You are registered in the correct method group, so you have to know what method you are using for a particular test. So for example, in creatinine, are you using enzymatic, or are you using the picrate method or the Jaffe reaction? So this has to be done as soon as you participate in the program for the first time. If you are unsure as to what method group you should be registered in, you have to send a copy of your reagent pack insert to the EQA program provider for confirmation. So I think this is it, no, for me, for this particular part of the program, after the presentation of Dr. Paulo Belen and the identification of what results you have to look into in the reports and what are the corrective measures that you can do, no? So this is my part, and thank you very much for your kind attention.
Thank you so much, Dr. Rodel. I think everyone can relate to this topic, especially when we want to troubleshoot our EQA result. So let me call on Dr. Paulo Enrico Belen and Dr. Rodelio Lim for a short Q. So we have a from the floor, and maybe we can accommodate just one or two questions in the interest of time. So while Dr. Rodelio Lim and Dr. Paulo is connecting, Dr. Pau, Dr. Rodel, are you here? So to question here, may any one of you can answer. So if a laboratory consistently fails in their EQA, what steps do you recommend, or what are your tips on how they can improve?
Sarah, I lost you. Can you hear me,
Yes,
Sarah?
Doc.
So
Yes,
can
we
I
can hear
answer that
you,
question?
Doc Rodel.
So I think it's a
Yes.
very
Yes.
long process to really identify the cause of that problem, because majority of the time, if there's consistent failure of a particular analyte, you have to really review the kits, or maybe check on what type of kits you are using. So did you enroll in the right methodology, and also have you applied all the precaution that is recommended by the manufacturer? And also you have to maybe go back to the sources of how the reagents are delivered to the lab, how the reagents are source of the and of course you also have to inquire users of similar kits as to whether they will have similar problems or not. And of course, the best person to help you here will be the product specialist of the manufacturer of the kits, and also your supplier. So I think that's how it that will be how it has to be done. No, most of the time, especially if you have consistent failure in the EQA program for a particular analyte. And of course, we have identified that some analytes are really very unstable, and therefore it will not really easy to go about the process of troubleshooting this particular analyte. So the best assistance will be coming from the supplier.
Thank you, Dr. Lim. There's another question here. To do an RCA when so Dr. Rodel and Dr. Pau may answer this question.
Can you repeat the question,
Can you
Sarah? I lost the last part.
the question again? Sorry.
Sorry, the question is it necessary to do an RCA when each EQA performance is poor?
Pao,
They
you
were
want to
asking
answer?
if
So
it's
that would
necessary to
happen.
do RCA.
Yes. So the question is if you always need to do cost analysis, the as of APT process a while ago. At the end of the day, when you get summary report from the provider, you actually fall. Do you fall in the acceptable, or do you fall or unsatisfactory? So you should always have proficiency testing performance would indicate there if you pass or not. And then fishbone, or you should do the five whys to actually identify the cause. That would actually depend on your laboratory, because some laboratories actually allocate the fishbone, the big root cause analysis, long-term problems, but for the shorter-term problems, or the not quote-unquote big problems, as long as the laboratory will be able to identify the root cause, address the concern, that would be it. But if the problem is repetitive,
For example, month in, month out, the EQA results are problematic. Well, that's an indication of performing cost analysis for this if you can identify.
So
Thank you,
in
Dr.
short, the
Pao.
root cause analysis typically apply to long-term problems. The doing of root cause analysis will typically apply to the long-term problems that the lab is facing.
Thank you for those answers. And then for the last question, I think some of the questions here have a similar theme, and I think they're trying to ask is, what do you do if your EQUAS there's this discrepancy between your EQUAS result and then your internal quality control and calibration? For example, if your internal QC and calibration are okay, but your EQUAS is not uh, reflecting very good results.
Answer on this, and you can follow up. So as I mentioned a while ago in the basics of an EQA program, the EQA program is a better assessment the accuracy of the laboratory um, or the laboratory performance. The IQC material is there to give a bigger picture of the precision or day-to-day running of the laboratory. But again, there are targets there on the values set by the IQC writer. So I think the question here is you should really analyze why you actually failed the EQA program. As I mentioned a while ago, do you have commutability issues? Do you have matrix differences? You should analyze from the pre-analytical and post-analytical because at the end of the day, it might just be a coding problem a while ago. In majority of my labs, the problem that I get is that there are some issues with how the EQA program or material is uh, usually pets that keep on falling down, that haven't been that actually has affected the quantities of the volume that they get and used to recruit, affecting the EQA, resulting to a situation where the EQA program is actually failing, but the IQC is doing well. So it would still depend on the analysis that you did on why you actually failed the EQA program. So, Dr. Lim, if you have any additions on the question, please, the floor is yours.
So just to add what Dr. Paulos mentioned, so in cases wherein the IQC is good, but then the EQA program typically will show some problems. So they have identified that you have to check whether you are deviating towards the negative side of the standard deviation or the positive side, or is there a trend or a shift that you that has happened. So majority of the time in cases like this, they will also be able to identify that the IQC or the running of the QC samples will show similar process. So if your EQA results typically will shift towards the negative side of the standard deviation or the negative bias that they call, so it will also reflect that your IQC will also have the negative biases. And in fact, for this particular problem to be addressed, you have to recompute and also to readjust your standard deviation. So this is what is usually done in these cases, just to address, because the as soon as the adjustments has been done, the typical IQC reports could be more acceptable or come out to be better, and also the EQA program will also show similar effects. So I hope this suffices to the one who asked the question.
Thank you so much, Dr. Lim and Dr. Belen. I think we learned a lot from from you today, and thank you for sharing your expertise and knowledge. Everyone learned a lot. Improvements also in the way they handle their EQA.
So we
And
apologize for
so
the
before I
very
turn
weak signal.
just for the technical difficulties earlier, and we just
Yes.
like to remind everyone that you must fill up the EQA survey, and then the link to the attendance for the Philippine participants are located in the chat box also. And for those especially using their computers, you can actually see it at the lower left part of your screen. And the certificates of attendance can then what else? I think that's it. And then for those with the wrong name, I think it's the way you registered in it's based on the information that you entered when you registered to this webinar. So I'll turn this over to Dr. Pradeep Kumar Dabla, the chair of the APFCB Committee on Communications and Publications for the closing. Thank you so much.
Great. Thank you so much.
Right.
Thank you to everyone.
All right. So thanks to Dr. Sarah Jane, who was our kind moderator from the Philippines Council for the Quality Assurance in Clinical Laboratory, and we sweetly call as PCQ ACL. So thanks, Dr. Sarah Jane, for bringing up this very interesting topic of the EQAS evaluations, and that too, you know, evaluating into its resource limiting setting. And of course, as a part of our clinical lab settings, both IQC and EQAS are close to our heart, and we always love to learn and hear more about it. And I see that, you know, such sessions always bring the eminent speakers from all the sides together and to share their experience with us, with the participants. So, on behalf of the Asia Pacific Federation for Clinical Biochemistry and Laboratory Medicine, I convey my heartfelt thanks to APCQACL and to our moderator, Dr. Sarah Jane, and to our eminent speakers, Professor Paulo Enrico Pivalen and Professor Rodilio Dille, for bringing these topics of the QAS valuations close to us. And nonetheless, but of course, it would be not okay if I forget our eminent and our loving participants that who joined with this session today. And to tell you, this was one of the best sessions that we had since we started the program, with the number of registrations counting in thousands, and closing the registrations at the end because so many are pouring in, and we were having the not having the enough data to include everyone. So my heartfelt thanks from the APFCB to all of you, so to stay with us. And I'm also very thankful to Dr. Deepak Pachwani and Dr. Mayank Upadhyay, again the part of our committee, APFCB Communication and Publications, and also the moderator for these programs. And I'm also thanking to Kudal Ortho for supporting us and being a corporate partner to support the sessions and program throughout the time. And again, thank you very much to all the participants. But please don't forget to give your time for this survey at the end, because it will help us to know more about the requirements and to develop more need-based programs. And also, don't forget to scan the QR code for your credit hours. So, thank you very much to all of you, and namaste from India. Thank you.